Okay.
Look at me.
All
Look
right.
at me.
Okay.
Okay.
Forget about the
Yeah,
cameras.
forget the
Okay.
camera.
All right. So I'm Hadiza Galadanci, a professor in obstetrics and gynecology at Bayero University, Kano, as well as the director of African Center of Excellence for Population Health and Policy, Bayero University, Kano, Nigeria.
Okay, nice to meet you.
Nice to meet you also.
What has inspired you about the forum so far?
I think one thing that has really inspired, okay, what has really inspired me about the forum so far is the number or the spread of the stakeholders that are in the forum. I think the forum has done excellently well in trying to get all the stakeholders that are necessary for child survival to be at this forum. You're looking at the global leaders in terms of health. You're looking at global partners in terms of health, UNICEF, Bill and Melinda Gates, CHAI, UNFPA, USAID. You're looking at academicians and researchers that are doing a lot of research related to child survival. We've seen the CHARM trials, we've seen all the trials that are taking place in different parts of the globe. You've also seen clinical clinicians. So we have obstetrician like myself looking at maternal health and how maternal health can actually impact on child health. We have pediatricians. We have public health physicians. We have advocates. We have women leaders. We have women that are talking about women empowerment, talking about women education. And of course, you have people that have to invest, people that have money that we can really use to improve the survival of the children across the globe, like Gavi and Bill and Melinda Gates and so on. So I think the forum has been able to let us know that we all have to come to the same table, we all have to talk the same language, and we all have to work together. We have to align together, and we have to accelerate, the need for child survival. We were on track probably before the COVID, and then the COVID has come and has really made us to go back. So really, it's time for us to really come together, work together, collaborate together, partner together, align together, so that we ensure that every single child survives and thrives.
Very, well, very strong message.
Yeah,
Thank you.
yeah.
When you return home, what is one thing that is going to change as a result of the forum?
I think probably not. Well, okay, one thing, I think there'll be more than one thing that will change because of the forum, when I return home. And one is to be really an advocate, try to advocate for, political will. Our government have to have the political will to invest in child survival. And one of the biggest investment is in terms of immunization. We have seen how immunization has really saved the world. We were at the brink of the world being extinct with COVID, and it was vaccine that saved us. So the same thing with pneumonia. So we need to really hold our government, responsible and accountable to ensure that every single child that requires a pneumococcal or pneumonia vaccine gets access to that. We also have to continue to advocate to our government to ensure that they strengthen the healthcare system, because the healthcare has to respond to these children. We cannot allow 600 to 700,000 children dying every year from preventable diseases. We cannot sit down, and we have to hold our governments responsible. And we really need to know the relationship between maternal health and child health. This is my field, and therefore I need, one of the session really showed the intricate relationship between maternal and child health. If we really want to save our children, we have to save the mothers first. Most of the women that die have their children also dying at the time of delivery. And it is the empowered mother, it is the educated mother that will use the healthcare system to first save her own life and then to save her child. Because when she's alive, then she can ensure that her child access healthcare, her child gets the immunization. But when the mother dies, the child has 80 to 90% chance of also dying. And if he survives, he had 50 times more likely to die within the first 5 years because of malnutrition. Mother is not there to breastfeed because of lack of nutrition, and therefore malnutrition will kill him. And then, of course, no education, no good water, no access to healthcare, no immunization, because it's the mother that would take the child for immunization. So we will continue to advocate to ensure that there is integration between maternal and child health in our various countries, to ensure that we strengthen the healthcare system, hold our governments accountable, ensure there is increased investment for healthcare, and ensure that we work together for the survival of our children.
Okay. And why child survival action is needed?
We cannot sit, as I said earlier, and allow 600 to 700 children dying every year from a preventable disease. We know what causes pneumonia. We know how to treat pneumonia. We know how to prevent pneumonia. We know the risk factors, the risk that children get to get pneumonia. So why can't we prevent it? And we have signed to Sustainable Development Goals. It's just 7 years to 2030. And we're saying that we want, under 5 mortality to be just 25 per 1,000 live birth. We want neonatal mortality to just be 12 per 100,000 live birth. We still have countries that are over 100 per 100,000 live birth neonatal death, and over 100 per 100,000 live birth in terms of under 5 mortality. And we have all signed to this declaration. So we've got to work hard, we've got to accelerate to make sure that we reach that goal. And so many countries have achieved, this target. So why do we still have over 50 countries that have not achieved that target? So we must make sure that these countries that have not achieved this target or are not on track to achieve this target they come back on track, and they learn from from the countries that have already achieved the target, so that we can all globally and as one world really ensure that our children survive and thrive. So that's the reason why there must be child survival action.